I'm letting you know that so you don't feel overwhelmed with your screen being taken over.
Okay.
Just starting up the live stream and the recording, so the audio will be going out. The card is the visual, and Anna will go to you at the top of the hour.
Thank you, Doug. Thanks, everybody.
Okay, have a great conversation.
Hi, Shorig. Didn't say hi to you yet, but hi, nice to see you. Brock.
Hitting all. Turn off the waiting room. Over to you, Anna.
Good afternoon, everybody. Bonjour tout le monde et bienvenue on behalf of Concordia University's Fourth Space. Located on unceded Indigenous lands in Tiohtià:ke, Montreal, Fourth Space is activated daily via live events such as this one to create engagement around the various research projects and initiatives and dialogues and development happening across the university. So to that end, it's really our great pleasure to collaborate with the Center for Interdisciplinary Studies in Society and Culture, and to welcome all of you panelists and all of the audience members who are also participants in this case into our virtual space for the first in a series of conversations on community health, today focused on narrative and representational practices of the body and health. I'll pass it over to CISC Director Mark Sussman in just a minute to get you situated, but very quickly before doing so, I'll just mention once again that you may have noticed we are in a meeting style. This is meant to be a community conversation consultation. We do invite your participation in any way you feel comfortable doing so. So you're welcome to turn on your video.
Anna is frozen for just a second. I'm sure she's coming right back. Let's give it just a minute. Hi, everybody. Thank you guys so much for coming. Maybe what we'll do is, Anna, are you back? Maybe Mark, do you want to start your introduction?
I'll jump in. I'll jump in.
Yeah.
And I hope I don't freeze. I'm in the same building, so presumably sharing the same bandwidth in the library building. Hi, everyone. My name is Mark Sussman from the Center for Interdisciplinary Studies. And I'd like to begin by acknowledging that Concordia University, the building I'm sitting in, Fourth Space on the ground floor, we're all located on unceded Indigenous land. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and waters on which we gather today. Tiohtià:ke, Montreal, is historically known as a gathering place for many First Nations, and today is home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. And we certainly feel that the question of connection to and acknowledgement of and honoring of the First Nations of this area and this place where we sit and where we meet is deeply connected to the questions we're going to discuss around community health throughout the term. I'd like to just begin by opening the first of these 5 meetings by thanking some of the folks who initiated these discussions, primarily the offices of the Provost and the Vice President, Research and Graduate Studies, Ann Whitelaw and Paula Wood-Adams, with tremendous support from the Office of the VPRGS in the person of Shorig Mikalian, and tremendous support from Fourth Space, from Anna and Doug and Kari. I want to acknowledge fabulous research assistant Doc Duchart from the PhD Humanities program, who's note-taking today in a visual mode, and as well as a written mode, and our ASL interpreters Jody Morrison and Andrea Konovic. So thank you for being here, all of you today. So this is organized as a kind of open discussion with some themes. I hope you received an agenda sent out a bit late in the game, but everything feels a bit last minute in our lives at the university. It feels like we're inventing things on a daily basis. If you haven't received a one-page agenda for today, just drop me a note in the chat and I will post it in the chat where everyone can see it. I guess I'll just do that anyway. But if you're not finding it, please let me know. These are conceived as discussions around the community health hub of the new School of Health that has been proposed by the university and ratified by Senate. So it's a project that's in the works. The community health hub feels to me like the most experimental and potentially the most I don't want to say ambitious, but a very ambitious component of this new school, in that it really has the opportunity to make very strong and solid links with communities outside and adjacent to the university. So the purpose of these meetings really is to discover how and where community health research is being done at Concordia. Many of you are doing it, and many of you have been doing it without any need of a giant umbrella structure. So we're well aware of that, but we do want to see where it might be benefit to you and your research, or where it might expand what you're able to conceive of and do with interdisciplinary connections. So these are discussions to try to link people laterally across departments, across faculties, as a community health hub comes into being. So we want to, foster an interdisciplinary conversation. We're going to be taking notes, and those notes will get compiled into a report towards the end of April, early May. And we're dying for your appendices, bibliographic references, manifestos, proposals, any kind of texts or any kind of representational material, really, that we can include. And this is going to be a package that's going to go to the new dean of the School of Health, the scientific directors of the 3 hubs. These are positions that are being searched for right now. So, we want colleagues in the health fields, in the humanities, in the fine arts, in the social sciences, and across the university, to think about what it means to talk about community health. And the topic of today is to focus even more narrowly, specifically on narrative practices and representational practices. How to writing, how to picture making, how to art making, how to visual and narrative representations of all kinds factor into the practice of health. And you guys are the experts. I'm a convener, and I'm very happy that a real expert is here to moderate the discussion. Ariella Friedman from the College of Liberal Studies. Sorry, I always get that wrong. Liberal Arts College. The Liberal Arts College is here as someone who works in this field and has convened a working group on the topic of health, humanities, and the arts in the Center for Interdisciplinary Studies. I don't know if you all are familiar with kind of what the university is saying about the School of Health, but I did include in this morning's email a document that comes right off the Concordia website that outlines what was proposed and what was approved at Senate, so you can consult that. So I think I will turn it over to Ariella. Oh, one thing we'd like to ask you to do, we had originally thought of a big roundtable meeting where everybody would take a chunk of time and introduce their research first, and then we would know who was in the room, and then we would begin a discussion. And in looking carefully at the numbers that have registered for today, it became clear that we would be more than 2/3 through our meeting if we did that. So what we'll do is ask you to, as you jump into the conversations, feel free by starting by telling us who you are and a bit about your research, and either what you do in this field or what you'd like to see this field become at Concordia. So I will turn it over now to Ariella.
Thanks, everyone. Thanks, Anna. Thanks, Mark. Like many of you, I'm guessing, since the School of Health was announced, I've been eager to think about ways in which questions of narrative and representation and the fields of health, humanities, and the arts might both find a place and be encouraged to flourish in this new unit. The stories and images that we use in our encounters with health, they're not only woven into our expressions, but they're woven into health practices, outcomes, and experiences. There's that famous, maybe too famous sentence by Joan Didion that we tell ourselves stories in order to live, but we definitely tell ourselves stories also to shape our illnesses, to understand our pain, our grief, even our death. I think what looking at narrative and representation can bring to the study of health can include not only complementary, utilitarian, or even therapeutic practices, like training doctors to be more empathetic through teaching them poetry, for instance, or communicating public health information in clearer and more vivid ways. Those are important, but practices of narrative and representation can also include ways of being critical, reflective, skeptical, creative, even disruptive. So one of the goals of this gathering is to learn more about the variety of work that you do at Concordia and how questions of representation and narrative might emerge in the School of Health. We have representatives here from a lot of different disciplines, literature, history, anthropology, theater, art history, communications, to name only a few. And we're going to have a conversation centered around the 3 topics in our agenda. So the first is research. What kind of research do you do, and how might it find a place in the School of Health and connect to other things that the School of Health is doing? The second question is about pedagogy. What kind of curriculum are we imagining? What kind of programs might flourish in the school? And the third question is about how your work engages the community and how the School of Health might provide a space and an opportunity for further engagement. So I don't expect everybody to respond to all of these. Some of these questions will be more appropriate for some of you, and I'm hoping that we have a chance to hear from everybody and to give everybody an opportunity to bring what they want to bring to this opportunity, which is the ability to imagine something together that doesn't yet exist. It's a kind of a generative opportunity, really. So I think what I'll do is I'll start with that question of research, and I'll start by asking you to just raise your hand if you have something to say about research on community health and narrative practices, and then I'll just call on people more or less in order for, I guess, about the first half hour of the meeting. And just to repeat what Mark said, feel free to introduce yourself and say a couple of things about how you relate to this new project. So anybody want to start us off? This is a brand new format, and this is an experiment. And we're going to see how awkward or how fluid we can be in having this conversation. Yeah, thanks, Valerie.
All right, well, I'll just dive in and break the ice. So well, thank you for organizing this and for this initiative. I'm professor of sociology in the Department of Sociology and Anthropology. And my fields of research include emotions and emotionality, well-being, suffering. I'm launching my most recent book on February 11th, so I hope everyone can make it. I think it's very, very relevant to this particular project. The book is on anxiety, but from a sociological perspective. And so I in the book, I develop theoretical and methodological orientations and ideas and arguments for better integrating and paying attention to how sociological, psychological, and neurobiological phenomena and the concepts that we generate at all of those levels are connected to health and well-being and suffering. So, well, emotions as narratives, I really like that idea. I think of emotions as, in many ways, scripts that we generate in order to get by in our lives. And those scripts are shaped by our experiences, the concepts that circulate, but also that we constitute through our embodied experiences. So I'm very interested in that interface. And I think of emotions in a lot of ways as narratives, without reducing them to discourse in the conventional sense in which we've been thinking about it. And well, maybe I'll stop there. Thanks.
Thanks, Valerie. Are you working with visual representations of anxiety in your book at all? One reason that I'm curious is because my work is on graphic medicine, and I've been looking at images of pain and representations of pain. And pain is a little bit like anxiety. It's somewhere between just a ordinary part of experience and something which can be pathological. It's often invisible. It's not always easy to explain. And there's actually a pretty predictable visual language for how pain gets portrayed. Sometimes it's an external object attacking the subject. Sometimes it's a kind of a blurring of the field, like a dissolution of subjectivity. Are you working with those kinds of questions in your book?
I don't work on visual data at all, actually. I find the question really interesting. I do think a lot about pain. Pain is at the heart of how I understand emotionality, and my two main variables are fear and desire, and how pain fits into that. But I don't know about your work, and I'm intrigued, and I will definitely take a look. It's interesting. I think there could be some great connections there.
When you think about a school of health, what kind of opportunities do you think that might afford you as a researcher? What are you looking for in this new endeavor? What are some of the things that you imagine for your research?
That's very abstract for now, for me. I think connections, generating new connections, but also I think at the practical level, I find, as a researcher, I tend to be quite isolated, and I find that as professors today, are all of the things that we need to be able to do and to learn to do and do well. I'm constantly overwhelmed by my work. And I find that distracts from and takes away from what I'm really good at and what I should really be focusing on. So to me, if there can be more institutional support in terms of administrative, anchoring, grant support, all of those things that I just don't have time for, and that just, drain me. So, yeah.
Provoke anxiety, perhaps.
Definitely.
I'm pretty sure other people here work on fields related to emotion and embodiment. And I don't know everybody's profile, but I'm wondering if I'm right and if one of those people wants to jump in. Okay, I am looking at you, Omri. It's possible. But maybe VK as well.
I also see VK, yeah.
Yeah. VK, who wants to go first?
You can
VK,
go.
why don't you go?
Okay, nice to meet you. We'll continue. I'm a dance and performance scholar. I'm relatively new in the history department. I come from a background in the performing arts in both dance and theater. I'm working absolutely on questions of embodiment and emotion and histories of emotion. Some of the book project, the last chapter of the book project is on historical representations of injured bodies in motion, especially around representations of amputation, but not only, and of spontaneous healing. And then I'm also a family member of somebody who's been hospitalized during COVID. So I'm very interested in looking at these emerging legal and other taxonomies around and protections, but also not so much protections around family caregivers in Quebec and beyond within hospital practice as well that have passed during COVID. And so I sort of see the current writing project and these questions around representing embodiment, feeling, and pain, also arcing into questions of how communities experience them. And I'll pass it on.
I think I'm going to bounce back to you that same question I asked Valerie. And I think it's a hard question to answer because a lot of us don't really know yet. How could the School of Health be something that would help our research? How would our research find a home there? How could it be something that maybe this was a little implicit in what you were saying, Valerie, like isn't another drain, but is something that can support us and be an opportunity? Do you have ideas about that in terms of finding collaborators, having opportunities to work with people together? The one thing that I am hearing from Valerie and maybe from you as well is that people are curious about who works in related fields and they don't know. So they're looking for connection. That was one of the things that Valerie said.
I think absolutely looking for connection and a sense of like, what is that pulse of conversation? And, you know, I don't need to add reading groups to myself, my life right now, but coming down the road and sharing work in progress at certain points, but also thinking about, you know, what it means to be somebody who had a first training in performing arts and a lot of somatic work many years ago when I was also walking into a hospital and trying to think about the fact that a lot of people who are visiting people in hospital don't have any framework for what they're experiencing, and it's extraordinarily overwhelming. And I have been working with patient advocacy to an extent on that. So I think there are real, at some level, scripts, at other level, tools or technologies or reserves of information that would really mean a lot to people. And having been through that as a family member for the last 4 months, that's something I can absolutely see being a kind of hybrid of practice and creative engagement, truly. I think music is a piece of that, and also collaboration.
Thank you. That's really interesting. It's interesting to think, and maybe this relates to the third part of our conversation, as one of the community-facing things that one could do is offer scripts for patient advocates. I hadn't really thought about that as a possibility. You know, I thought about expressive technologies or, you know, writing therapeutically about the experience of illness, but thinking about it as a script, I think is really useful. And something that relates to writing and relates to the performing arts as well. Really, really interesting. Thank you. So far as themes, I'm hearing embodiment, I'm hearing emotion and the history of emotion, I'm hearing the exploration of mental illness as well as physical illness. I'm hearing an interest in care, practices of care, and institutions of care. It's an interesting moment to be working on this right now because we've been thrust into a health catastrophe for the last 2 years. And there's a language that I think is coming back in a new guise. There's a lot of discussion of interdependence. There's maybe a new language of convalescence and perhaps new structures of convalescence with awareness of long COVID and concern about long COVID. And I think there's maybe just an increasing awareness also of mortality and complicated grief and unresolved grief. Omri, did you want to talk a little bit about the work you do as well? Is that?
Sure, I'm absolutely happy to. My name is Omri Moses. I'm a faculty member in the English department. I'm trained as a modernist scholar. And my first book is on kind of vitalist psychology and modernism. But over the years since that book was published, I have begun to migrate into kind of work on cognitive science and the health humanities. And so I teach courses, like I've taught a course called Psychosomatics about mind-body relationships and how they're figured in film, literature, plays, and other kinds of cultural media. And I'm about to teach in the following, next fall, a course called Idioms of Distress, which is a term taken from cultural psychiatry. And my interest really started with a branch of cognitive science called the 4 E's: embodied, extended, enactive, and embedded cognition. Partly because my sense is that it's a kind of burgeoning field that is interested in the way that our everyday embodiment organizes our psychological experiences, and so can provide a kind of a broad theory that brings humanities' interests in culture, in context, in language, in metaphor, and in narrative into dynamic relationship with kind of scientific models that are interested in the structures of the brain. But, and obviously I'm not an expert in neuroscience, but I do read now quite widely in that domain as well. But so I'm interested, pain isn't, and emotions are, I've taught a course called Theorizing the Emotions in Literature and Science. My early work is on affect and affect theory. So and I think vitalism, like Henri Bergson, early developments in the 20th century kind of anticipate these new models and theories. So in addition to the kind of work I do at Concordia, I've also been in engagement with the Division for Transcultural Psychiatry at McGill. And that is, I think, where I get whatever limited insight I have into the kind of institution building practices that I think we could borrow for the School of Health, because I feel like the humanities have kind of lost their wind a little bit, and the authority of the humanities has suffered, as we all know, in the last decade or two, and has been very beneficial for me to participate in disciplines that have the wind in their sail and to see how they do things. And one thing that I noted, I was invited by the head of that division, Lawrence Kiermaier, who's a cultural psychiatrist of renown, to come and give a talk. And in their summer school, and they have a whole set of institutional practices. They have a summer school that draws students across multiple disciplines, from dance to neuroscience and certainly health disciplines from all over the world. They have the journal Transcultural Psychiatry, and they bring scholars from around the world to come and give talks that then become, as part of symposia, that then are turned into special issues of journals. They have big mega grants. And, I'm impressed, not because I know, I'm just like the smallest cog in that universe, but to see how they move from common interests and the ability to create larger conversations among multiple players and multiple disciplines into something that involves practices of dissemination, research creation, grant writing, group grant writing, that really extends the boundaries of disciplines. So, I don't know how to build that myself. I get a sense that those structures are very nascent and that Concordia doesn't have a lot of practice doing it, but this is an opportunity from my point of view.
Thanks, Omri. So some of the things that I'm hearing so far in terms of the ways that the School of Health could function to cultivate research, and there were a lot of ideas on that, Omri, so thank you, that was really useful. From the pretty simple and local and small scale, like connecting to one another, eventually having reading groups, eventually sharing works in progress, like building groups where faculty members can support each other, but also on a larger scale, maybe focusing on group grants. So perhaps finding people whose work, like yours, overlaps between questions of metaphor and narrative and neuroscience, and collectively, maybe with the support of research services at Concordia, and specifically the support of the School of Health, having grants come out of the School of Health designed to integrate the humanities and interdisciplinary work into these larger questions in a fuller way. So I don't know if establishing a journal down the line, that's a huge amount of work, but it's a really interesting idea, and it can be a very, very productive way of like concretizing the contribution that you're making to knowledge, and also getting known as somebody who engages in those sorts of questions, but certainly inviting other scholars in so that it's clear that the School of Health is a place where people come who are doing really interesting and exciting work that, again, in this interdisciplinary way, asks these questions, so that the humanities is not outside of this conversation, it's engaging with those conversations. I agree with you, institution building is really hard. And I think some of the answer to your question of like, how does that happen is probably just a lot of hours from the people involved, but maybe beginning to connect those people is a first step. Kate Bly.
Ariella, can I just jump in one sec?
Yeah,
just
sure.
before we go to Kate? Thanks, Omri, for that, and for bringing a perspective from another institution outside ours as to how they're kind of constructing a space that is interdisciplinary and cross-disciplinary, and that sort of values and supports that. And I feel that at Concordia, that hasn't been so much our strength yet structurally. We're familiar with the model of being encouraged to go find partners and to construct partnerships and to go for grant funds. But there's something a little more, I guess the word I would just use again is structural, that we're very siloed, we're very separated in our departments and our faculties. And I do feel that what attracted me about getting engaged with the School of Health, it's not exactly my field myself as a performance practitioner, but the interdisciplinarity of it is extremely interesting to me. And the thought or the fact of having an annual summer seminar or a summer field school or all of the above, or a PhD program, devoted to these sort of cross-disciplinary ideas, strikes me as very exciting. So, Omri, it's really helpful to have a sort of a model from outside, and maybe we'll ask you to talk some more about that, either in this meeting or maybe outside, just as we go along. Finally, I just want to say one other thing, which is today we didn't invite guests from outside Concordia. We wanted to just start with an internal conversation. But as these meetings go along, we certainly are thinking about bringing in some practitioners from institutions that have these kinds of cross-disciplinary schools in existence. So perhaps from down the street at McGill, or from University of Northern BC, for example. Those are a couple we're thinking about. Anyway, forgive me for jumping in, Kate.
Sure, thank you. Thank you so much, Mark. I'm just seeing two people have hands up. Shall I pause while they bring their points, or would you like me to bring mine instead? I'm just wondering how.
Oh, I'm not seeing the hands. I'm very sorry.
Okay, I'm
I see Valerie
and Enrico have got hands
Valerie
up.
and Enrico. Valerie and Enrico, is it okay if Kate goes ahead, and then Enrico maybe, since we haven't heard from you yet, and then Valerie once again. And yes, if you can use the little blue hand, it might be easier just to keep track of. That would be terrific. Thank you. Okay, go ahead, Kate.
Thanks so much, Ariella. So I know a couple of people here, and hello to you, but there's a lot of people who don't. So I'll just briefly introduce myself. I'm a white, straight, cis woman. I've been a settler in Canada for 26 years. I was born in London in the UK. I've been teaching at Concordia for 24 years now. In the English department, I teach a wonderful course called The Creative Process. And I also have been a teacher in the theatre department and occasionally teach in Irish studies. I have much more experience as a practitioner. My background is as a theatre director and a playwright, and as a coach in various ways. So I'm much more a practitioner than a researcher, and I've got all kinds of links going on with all kinds of communities, which is why I was drawn to come and participate today, because I've been feeling that a number of my activities could stand to be researched. So I guess I'm just kind of here to set my wares out a little bit to see if anybody's interested in forming any kind of a collaboration or a partnership. So I'm just going to kind of riff through some of the stuff I do. So for the last 10 years, I've been training young surgeons for the McGill University Health Centre. So for 8 years, I was training 40 of them a year. And then a year ago, it actually went up to 350 a year. So I have the incredible pleasure and privilege of, at the moment, it's online training, but before the pandemic, it was actually in-person training, really under the umbrella of communication skills, which is really in the area of empathy. So I give specific courses on constructive feedback, on delivering bad news, and I use role play for that. So one of my challenges and my privileges there is to script those exchanges, to create characters who adequately represent patients that they're going to be dealing with, and to script situations which adequately enable the surgeons to understand what they're dealing with when they're dealing with it. I also give sessions in skillful communication to those doctors. Now, they're all qualified doctors. They're just beginning their specialist training. And I also, these days, I do trainings for them in cultural sensitivity, both in terms of how they interact with their patients, but also what to expect now they've just arrived in Montreal. A big chunk of every cohort come here from the Middle East. And so I have this incredible job of preparing people who have been trained either in the States, but have grown up in the Middle East, for spending 5 years of their lives in Montreal. And that includes telling them all about Bill 21 and what they might expect. So it's a pretty fascinating engagement, I'll just say. So right now, recently, the last year or so, they've invited me to possibly, well, not them, but so the Society of American Gastrointestinal and Endoscopic Surgeons have invited me to interview surgeons about how they get their lives right. And this is because there's incredible statistics showing that surgeons get addictions, they burn out, they kill themselves at higher rates than any other professionals in the world. And they're trying to figure out what it is that the happy surgeons are doing well. So rather than pathologizing the ones they lose, they're actually doing a really fascinating inquiry. I get to sit online with a surgeon for an hour and ask them about how they make their life work. And the narratives that are coming out of that are completely mind-blowing. So we're transcribing those interviews, and then the next stage is going to be some sort of quantitative research into those. But I'm finding them absolutely fascinating, and I have to say incredibly uplifting. But I'm also really getting a point of view of, you know, life from a surgeon's point of view, not in terms of their skills or what they provide to people, but in terms of how much they suffer and how they process their own emotions, which is absolutely spellbinding. And it's, you know, it's an incredible balcony on a very rarefied world. So I'm doing that at the moment, and that's ongoing. And then just recently, they've contacted me. So I don't know if any of you heard of grand rounds, but grand rounds are when all the surgeons in one particular health system all get together for some kind of a training. And they've just asked me to deliver a grand rounds based on my experience of training their residents for the last 10 years. So I've just been handed this incredible opportunity. Like, I've got an hour and a half to tell all of these influencers and decision makers what I'm understanding and learning that young doctors need to learn. So it feels like an unbelievable privilege, but I'm also a bit daunted about preparing that talk, and I'll be doing that quite soon. That's very exciting. Then I also, you know, the other end of the scale, I'm a certified life coach. So I coach doctors. I do one-on-one helping of them. Not, you know, I don't do counseling or therapy, but I do, okay, this is going on wrong in your life, and how can we fix it? And that includes ones that are in trouble for being too angry, or ones that are in trouble for being sexist and racist. I actually get to sit down with them and try and help them fix their attitude and understand how they need to be to actually function function in the system that they're working in. So that's all kind of, surgeon focused work that I do. So, my background is I was trained as a theatre director and an acting coach, and I had that practice for 25, 30 years. These days, I'm much more focused on enabling people to perform themselves as their authentic selves in their real lives. And I also develop film scripts. So part of my practice as a coach is that I do pro bono coaching, and I've done a fair amount of work recently with women leaving sex work. So the trafficking industry and the sex industry in Montreal is beyond evil, beyond anything that anybody could ever comprehend unless you start working in it and thinking about it. And I've been doing various coaching with women who are being helped to leave that industry. And one project that I was particularly proud of was a completely fully bilingual woman who had been a sex worker who was leaving, and was asked by one of the Francophone networks here to be the main voice in a documentary that they made about trafficking and sex work. And it was my incredible privilege to train her to be able to perform on camera. And then they made this documentary, and I'm really interested in that going forward. I'm interested in enabling people who have been marginalized and oppressed to speak for themselves, to speak up and to speak their truths and to narrate their own histories, just in terms of helping them actually find their voice and helping them understand how to interact with a camera or an interview or that kind of stuff. So that's an area of my work that I'm very interested in expanding going forward. I also do a lot of anti-racism and diversity, equity and inclusion training, and just a kind of brief thing. So that's all of kind of my professional practice. On a personal level, I'm a colon cancer survivor. I had very serious surgery in 2012 for colon cancer. I was told I had a year to live. And then 4 months later, I was told I was probably going to be okay. And in 2006, I had a really horrendous miscarriage at the Montreal Jewish. So both of these experiences of horrendous surgery and being told I was dying and this appalling miscarriage I had, I've written and written and written about them. And my reflection on that writing, as I've got it all sitting there, I haven't actually done much with it, was this, that prior to those experiences, my main engagement with emotions was in pretending, right? Was in directing actors, was in looking at the canon of great scripts, or even just recently made scripts, looking at the faked or the imagined representation of emotions and feelings. And my experience of having these horrendous life experiences and kind of my own extreme trauma and suffering was having those experiences through the lenses of fake emotions and noticing the real emotions when they were showing up and how they were expressed. And so a lot of my work has been, a lot of my writing in these areas has been around those things. And as I say, it's all sitting there. I haven't really done anything with it. A little other thing is I've done a lot of work with the Côte d'Ivoire Black Community Association. They have an incredible program called Strengthening Families, where they go in and help families that are in danger of having their children taken away from them, and they train them to be better parents. And that program is ongoing in Montreal. It's one of the little gems of engagement in the city. And I know that not a lot of people know about that program, and it absolutely stands to be researched and investigated and looked into. My role there was training the trainers. Anyway, that's enough. So I have lots of stuff going on. None of it's research at the moment, but I'm very interested and excited about the prospect of partnering with people who are do have overlap with me. Thank you. Thanks for listening.
Thanks, Kate. Thanks for letting us know about all of the very important work that you're doing. I know that Enrico and Valerie were waiting, but actually, Kate Stearns, do you want to talk about your work with doctors as well? Because it seems in some ways related. Or do you want to wait and talk about curriculum?
No, I mean, I can talk about both, but yes, Kate Stearns, I teach in the creative writing program. And in 2019, much like Kate, I was approached by medical students at McGill's Faculty of Medicine, and with Stuart Lebarsky, who's also at the Institute of Health there, taught a workshop in narrative medicine, which was a wonderful and exciting opportunity for me. And it wasn't a branch of writing that I'd really been familiar with, although I draw on medical history in my own fiction. And my father was, for many, many years, a professor of medicine at Queen's, so grew up very much in the medical community, so it felt like a good fit. But just to really emphasize that the narrative medicine approach had so many positive implications for the students. They really found it did help them better empathize, which is the word that is always used, although my experience of the students where they were already incredibly empathetic, but they were able to better communicate with their patients from the study of literary texts, from the sort of practice of close reading and reflective writing, which McGill, in their more traditional format of medicine education, did not allow for. So that was very helpful to them. It helped, obviously, to develop their writing skills across a range of platforms, not just creatively, but articles, case studies. Particularly, Dr. Lubarsky-Stewart was very keen on helping students develop this ability to express themselves quite clearly, and to engage with different literary techniques in dealing with patients, like learning how to read implicit clues when patients offer their narratives. And this is certainly echoed by my father. Patients will often tell you, but very indirectly, what's worrying them and how to approach them. So that was helpful. But of course, ultimately, it was their mental health too. These students were put into very traumatic situations through their various rotations, pediatrics, oncology, and so on, psychiatric. And so the ability to sort of write their experiences, to express, but also to share them, was tremendously beneficial to them and incredibly moving to me. And I'll talk more about this when we get to curriculum and ideas, but my enthusiasm for the workshop has certainly led me to try to foment a narrative medicine class with my colleague Maggie McDonald, who's also here, head of professional writing. But I was also asked to develop a proposal so that touches on 3 different hubs, and I'll talk about that more when we come to ideas of curriculum, and and to build on what people are saying about sharing of research, but also how it can be maybe more forward-looking into the community. I'm not a researcher, I'm very practical, I'm a writer. So my firm interest in this is, how do we bring all the really interesting creative ideas that are going on here and translate them into something that really has far-reaching consequences for the community, the medical community, public health policy. I feel like the last 2 years have shown us we need to radically revise how we consider policy. And so the idea of drawing on research and teaching, having courses, an alignment of courses that allow students to think very differently about medical practice, social care, architecture, journalism, all environment. All of these are touched on now by public health policy, or should be. And I think we can be at the forefront of creating new practitioners. And that's a really exciting thing. So thank you very much.
Thank you so much, Kate. I'm going to get back to you on curriculum really soon, but I'm eager to hear more about what that would look like, and also, who the students would be, because one thing about McGill is you have these medical students sort of in place for you. Who are we speaking to, and how are we getting to them, and are they students within our program, or how do we reach the parts of the community that we want to reach as well? Enrico, sorry to keep you waiting for so long.
No, not at all. First of all, thank you so much. It's really a pleasure to be here and to meet everybody. A second ago, when Mark was just mentioning that, one day in the future, you hope to extend the invitation to people from outside of Concordia, I thought that would be a perfect time for me to chime in. because I'm probably one of the biggest outsiders in the meeting today. Although I'm part of the part-time teaching faculty at the Applied Human Science Department, I'm a PhD student at University of Toronto, coming from a master's in kinesiology and physical education at McGill. Before that, it was an education degree, a Bachelor of Education at Concordia. as a language teacher. So definitely coming from a very multidisciplinary background myself, I wanted to take advantage of the opportunity to introduce myself and to talk about some of the work I do, and also express my interest, my absolute love for this discussion, and any potential or possibility to get involved with projects that might stem from this, and in an effort to really kind of direct my future in this area. So interestingly enough, when I went from education to kinesiology and phys ed at McGill, I had the support of people who wanted to explore my interests in research, and I had the opportunity to be involved with a very in-depth analysis of what exercise was like for people with severe traumatic brain injuries in the community. So that's definitely my focus is people with traumatic brain injuries, or TBI, and the role that exercise plays in the recovery process in the long term. And so stemming from the work I did in my master's and the research I did then, the findings of the study that I led, I was able, and it was very much project driven, and to develop a program in partnership with the YMCA's of Quebec and the Quebec Traumatic Brain Injury Association that incorporated physical activity for a group of adults living in the community with traumatic brain injury who can no longer work due to the disabilities that they live with as a result of their brain injuries. And we were fortunate enough to get funding to be funded from the SSHRC, from Social Science and Humanities Research Council, this insight grant that had everything to do with sport participation, because the program itself that we were running through the downtown YMCA, which is very close to Concordia, just a couple of blocks over, focused on, helping these individuals learn how to train and be physically active. So definitely revolving around physical literacy, and then adopting more autonomy and independence in their training and their physical activities. And then the third phase of the program, and it was a 9-month program, focused on having them learn how to train for and participate in a sport challenge. And the first 2 years of the program was tremendous. They were involved in an indoor triathlon at the downtown YMCA. They exceeded everyone's expectations. And then the last year of the program in 2019, we went outside the Y, and they were all participating in an outdoor 5-kilometer run walk race on Mount Royal, which was just tremendous. And by that point, we had expanded the program to 20 participants. We had started with 12, and then we expanded to 20. And it all relates. It's very much closely related to leisure time physical activity and the kind of benefits that can be obtained for people living with disabilities. And I guess what I wanted to do was speak about my work, introduce myself, and speak about how interesting I think it would be to incorporate, some form of narrative or practice of representation that coincided with this kind of the way in which the participants, the people I've seen involved in this program over the years, were able to benefit from this leisure time physical activity, from their involvement in these activities. And although the pandemic did put a hold to that, we were able to run an adapted version of that program this past fall in an outdoor kind of setting, and respecting the measures and respecting guidelines with masks and everything. And it was tremendous. Anyways, so just wanted to put myself out there, tell everyone how happy I am to be here, and thank you very much for including me, and explore any possibility of collaborating on these kinds of fronts in the future, because I would definitely love to see myself at Concordia for a lot longer.
Thank you so much, Enrico. I want to transition to our discussion of curriculum, because I want to make sure we have enough time for that. But if you want to talk about your research and you haven't had a chance yet, now is your opportunity. So if you want to throw something out there that hasn't been mentioned yet, if there's a concentration you have, or if you just want to introduce yourself and your work quickly, you can go ahead. You can also introduce yourself when we talk about curriculum. That's also fine. So
yes, even brief introductions are very welcome, just so we have a sense of who's here.
Great. Marc Lafrance.
Hi there. Hi there, everybody, and apologies for not putting on my camera. I'm not in a position to do that right now. But I did want to take a moment to introduce myself. To start, I'd like to thank everyone for this really wonderful conversation. I feel really energized hearing about what my colleagues are getting up to. I kind of had no idea how many of us were working on these sorts of topics and thematics, and it's really important that we come together like this. So that's fantastic. I won't take too long to introduce my work. I work in sort of three areas that are related to what we're discussing here. I suppose the first is men's health and well-being, and a lot of that relates to male vulnerability across the life course in relation to a variety of sort of health-related phenomena that tend to touch men at least as much, if not more, than women, and the relative silence that surrounds a lot of that. So I suppose you could say that I'm interested in thinking about the forgotten realities of men's health and well-being. So that's one area I work in, and I'm editing a book collection on that topic right now. I also work on what we might call the psychosocial significance of the skin and the body's surface, which has become actually increasingly relevant in an age of pandemic, because we're very, very, very concerned about our body surfaces and keeping them clean and sanitized at all times. So that has crystallized a whole bunch of interesting things about the skin as an interface between self and the world, and just how complicated that can be in times of sort of catastrophe like the one that we're in now. So that's sort of the skin in the self is another area that I work in. And I guess the third one would be media representations of reconstructive surgery, cosmetic and reconstructive surgery, but I've been particularly interested in reconstructive surgeries of late, and more extreme surgical interventions like facial transplantation, for example, which also crystallizes a whole range of issues around, the distinction between self and other, mind and body, and sort of subject and object, all of these sorts of things. Facial transplantation really pushes us to consider the stakes bound up in sort of embodied subjectivity and individual identities. What does it mean to acquire a facial graft from somebody else? Lots of really interesting questions there. I've been particularly intrigued by media representations of this phenomenon, which have not surprisingly been pretty sensationalistic. It is a procedure that sort of is often associated with science fiction and gothic horror. And we see a lot of representations of facial transplantation over across the decades that repeatedly sort of presented as a terrifying and apocalyptic phenomenon that really spells the end of the human race. So there's been a lot to think about there in terms of unpacking the fears and fantasies that get represented as the media portrays these admittedly extreme and experimental procedures. Yeah, and I've also been interested in sort of makeover narratives, before and after narratives, and what that tells us again about sort of social fears and fantasies relating to surgically assisted body modification. So those are the three areas that I work in a nutshell. I think what I would like to say is I echo so much of what has already been said. I think I want to say to say in a very positive way something that is ultimately a kind of negative, but I want to say it positively, which is it is my sincere hope that we can use this exceptional new initiative as a hub for idea making, idea exchange, but above all, a focus on ideas. I would really, really like to see us move away from the idea that this is going to be a mere grant incubator, that we are surrounded by sort of grantsmanship, incitements to write grants at all times. I have heard on the grapevine or through the grapevine that this school is going to be mainly a vehicle for grant writing, which I of course find disappointing, and I'm energized to hear that there are lots of ideas on the table today, and I hope that we can move in that direction. We all know that we're expected to be applying for grants all the time. It would be really, really nice if we could do something more lofty with this school than mere entrepreneurship. So thank you very much for listening to me.
Thank you very much, Mark. And I think that a lot of us here are here because we're hoping this will be intellectually exciting. Like, grants are something that can create opportunities and support our work. And I think insofar as they do that, we understand the ways in which we need to be invested in them, but that's what we want them to do. And the opportunity to just light up in relation to other people's ideas and in relation to students and in relation to people outside the university, I think that's probably turns people on more than grant writing does. I don't know, unless maybe there's some very unusual people in this room who grant writing is absolutely their thing, but I haven't met those people yet. Just to maybe add to some of the categories I was hearing and naming, so questions of empathy, care, history of emotion, maybe under embodiment, I would stick something like skin and transplantation, like as subcategories perhaps. And Mark, I actually have an article about skin in James Joyce's Ulysses, which I can send you if you're interested. Something I've thought about a lot as well. It's interesting to think also about how media studies and medicine and literary tropes like trope of the Gothic all end up intersecting when you ask those kinds of questions. It really lends itself to that interdisciplinary work. And maybe gender and health. So that's something that came up in your talk, and that's something that I think is relevant to a lot of people around this table. So I had two more hands, but oh no, Debbie, your hand was up and then it was gone. Okay. And then I saw Gilbert.
And Laurel.
Gilbert, do you want to go ahead? I think you're muted. You're definitely muted. Yeah. And I think at 2:10, I'm going to go to curriculum, whether or not we're done. So I apologize for whoever I'm going to cut off.
That should be fine.
But it's not going to be you because you're next.
Me? You hear me?
Yeah, you're on.
Okay, sorry. Technologies, haha. I'm Gilles Berrimont in applied human sciences. My background is, strangely, mathematics, administration, and the communication about the sexual experience of gay men in Montreal as a base for my research in human sciences. I admire this involvement of many of you into a topic and to work on it and to get deeper and deeper about it. But I found that over years my specialty was to do methods and to help find information and knowledge where there was no evidence to get it. So I prefer to match myself with teams that are interested in topics and that can develop the content. For example, now I'm working on overdose and people using drugs, and of course, in such stories or in stories about homophobia or something that is about two-spirited people, there is always the body that is important, that is central to what is there. So I was interested in this talk today because it's near my domains of interest, but it doesn't mean that I have a specialty in that. And just for advertising, the point is, for example, when I give my course on sexuality and human relations, one big topic that comes right after on the week 2 is that all the representation that we have of bodies are white, non-colored meaning everyone has genitals that are pink, where the majority of the world has some genitals that have much more darker skin or around that place. And it brings a lot of questions and impossibilities for me to be, I do denunciation of colonialism into that, but more than that, I think that we should always take care of who we represent and how it is represented, not only with the skin of the visage, the face, but the body and how we do it and how these people live in their environment. Sorry.
No, thank you. So maybe what I'll add then to our categories is maybe something like race, culture, and representation, because Kate Bly talked about working with doctors to train them in cultural sensitivity. VK talked also about kind of cultural specificity in the medical encounter, and you're raising these points of stereotype and also just of exclusion and invisibility. And certainly all these are narrative questions. All right, Debbie, sorry, I had called on you and then I snatched your microphone away because I didn't hear from you right away. Here you are.
No, I'm sorry, it's my fault actually. I just wanted to, it's very short and sweet. Me too, I didn't know what to expect when I came today, but I find it so inspiring, everything that everybody's doing, and love it. And I'm hoping that it's going to really lead to something. I simply wanted to add the dimension. It's an angle that really touches on almost everything that was said so far, but my interest in particular is through translation. So translation, written, as well as the interpreting, which is the oral translation. I would really like to see a component within the community, how involved translation, not only what we know typically between English and French, but also those communities who express themselves very differently culturally and linguistically, immigrant communities, indigenous communities, including, I see we have our faithful interpreters here today, including for signing, and all of this. I would love this to be a dimension, an angle to somehow fit in with everybody else's, and that's all I just needed to say.
Yeah, that is so important. And I think that also connects to something that Kate Stearns was saying earlier about policy. Like
yes.
Policy has just impoverished the possibility of translation within the hospitals very, very severely just in the last couple months. So
yeah, absolutely. There's the community interpreting that really touches everything, and some of that is outsourced. Many of the community interpreters are not trained in any substantive way. They certainly lack, they learn as they go with medical knowledge and being exposed to different clients in different scenarios. But that would be important. And then something that I know just from the north, where there have been some works that have been written lately and some talks lately about children who have been flown down for medical services from the far north to Montreal, Quebec City, and have come without family or anybody from their community, and hence are left on their own without any kind of possibility for a cross-cultural mediator or language mediator, any kind of interpretation. And then this was actually the subject of a book by a doctor not too long ago, who I think recently spoke in public as well. So yeah, there's so many different angles that it can interface with different sectors of society, I think.
yeah, sure. And it's linguistic access, but it's also the ability to culturally translate.
Oh,
the way that
definitely.
people talk about their illness, depending on where they're from.
Linguistic, cultural, and then even various subject specializations. Because when you train, usually it's a bilingual. Even children have been called in to be interpreters in hospitals, and to give bad news to a parent who might be dying, right? So there's all kinds of issues here. But that's something that I would like to expound on a little bit more later. But for now, that's all I wanted to say.
Thank you so much, Debbie. I think we have two more hands. So Laurel, I think you were first.
Yeah, and I promise you I will be very, very brief. I do have to go. I just wanted to introduce myself more than anything else to everybody that's here today, and I'm very happy to hear about everybody's work. I don't know most of you, which is surprising because I have been at Concordia. This is my 11th year here, so I am hidden maybe a little bit in the Department of Creative Arts Therapies. I'm an associate professor of music therapy, and I think I'm the only one from my department here today, so I'm really glad that I did come, because I don't think that there is often enough interaction amongst us and other parts of the university, and even within our own faculty. I think we could certainly strengthen those relationships. I'm also the Associate Director of Engage, Concordia's Center for Research on Aging. So I am pretty active in aging research and end-of-life research. And I think what I bring to my work is that I've been a music therapist for 25 years. And prior to coming to Concordia, mostly working full-time in the field. So I have worked in hospitals, I have worked in community health settings. And I think the unique thing about the arts therapies, although I don't want to speak for them all because we all have differences as well, is that we really sort of straddle this really precarious or position of being an art, a science, and a humanity. And so people are kind of mixed up about who we are and what we do. So I resonate with a lot of the things you are saying. And it's also important actually for me to tell you too that I'm a musician. And people don't often, they hear the word therapy and they kind of stop there and forget about the art part of me. And I'm on sabbatical right now. So a lot of what I'm trying to do is reconnect with my musicianship that I often don't have time to do when I am doing my full-time job. So just very quickly, I really focus on a salutogenic perspective to health, which is kind of challenging the normal pathogenic ways of looking at things and over pathologization. So I challenge notions of aging, dementia, end-of-life care, and how music can help and how people perceive what therapy is. So that's a lot of the work that I do. It's situated within a social justice perspective. I do work with bereavement as well. Anyway, I'll leave it there. I said I would be brief, but I just wanted to say hi to everybody and introduce myself. Thanks.
Laura, what's your instrument?
I studied piano performance in one of my undergraduate degrees, but I actually do a lot of focus on singing and guitar playing right now. So part of my sabbatical plan also in terms of narrative, I also wanted to put the pitch in there for songwriting, because songwriting with clients and patients to express their experiences, lived experiences of health or non-health is something that I do. So yeah, I do a lot of singing and songwriting and guitar playing, but I was a piano major in university.
Great, thank you so much, Laurel. Thanks for introducing yourself. It's so nice to meet you. The art therapists are, you know, many of us are relative novices, I think, to engagement with health. Not everybody, but health humanities is a lot younger than art therapy as a field. So we stand to learn a lot from you. Rebecca?
Hi, everybody. Again, I'll be very brief. I just wanted to say hello and quickly introduce myself, and in a way, I guess, sort of reintroduce myself to the Concordia community, because I was for some time the Dean of Fine Arts, and now I get to reinvent myself as a faculty member, which I'm very happy to do. And in my own personal work, I am moving towards something that may become a research area, but right now it's an area of personal interest in teaching, and that is particularly work around death and dying. So in the few months that I had off after my dean mandate, I became a registered death doula. And I have picked up volunteer work on a palliative care ward. So I'm very interested in sort of moving towards the ideas around narratives around death and dying. Particularly, I proposed a course in art history to look at the role of analogies and metaphors in narratives of death and dying. So I'm both interested in the visual culture around this, but also the language and literary aspects of it. So I just wanted to put that flag out there, and you know, in case that is something that comes up. The second quick thing I'll say is, I guess, you know, drawing on previous work as a dean, I'm also very interested in helping to think about radical and innovative structures for something like a school of health. I think a lot of very useful and interesting notions of practice and performativity and project-based work has come up today, and I would just love to say that I'm very keen on looking at and drawing upon previous knowledge of very more radical ways of structuring things like schools of health. So thanks so much. It's great to hear from everybody. I'm feeling invigorated and revived, as many of you have said so far.
Thank you so much, Rebecca. And that is invaluable experience. So I hope the School of Health I think Mark is taking notes, and his people will call your people. Is that what we
a number of us Brock and Showrigger taking notes on the Miro board. I'm scribbling notes. So we gotcha. But thanks, Rebecca. That's great.
Yeah. Those questions around death and dying and the work of the death doula also relatively new, right? Or at least there are more and more people involved in it, and there's more of a language around it and more visibility around it, and certainly bound up with a different kind of story told about the end of life, entering into the end of life with a different kind of story.
Absolutely, absolutely. And there's some great work being done by people like BJ Miller. I mean, there's, both from the side of physicians, but also caregivers and patients themselves. So, and I think this came up with Kate, the idea of a kind of more humanistic training for people in this work. It's oddly enough, dying is the one thing that we will all do, and yet it's probably one of the greatest secrets of what actually happens. So thanatological studies are very, very interesting these days.
Yeah. Another thing which is sort of tragically accelerated by living through a mass death event in a different way. We all have lived with mortality, but there has been a kind of a concentration. Yeah. I want to move us to questions of curriculum, because one of the things that the School of Health is going to involve is the opportunity for classes, graduate work, certificates, and none of this really exists yet. It's got to be laid down, and it's possible that eventually some people are envisioning a medical school, but that's certainly not what we're beginning with. And in a way, that is a kind of opportunity, because it allows us to structure an education, not just around that formal certification process, which is actually pretty regimented and pretty laid out already, but in some other guise. So maybe Kate, I'll just invite you first to talk about this, because it's possible you actually have the most developed idea here around that.
Sure, but I would just put the caveat that this was a sort of informal invitation for me to develop something, which I did with a colleague who is unfortunately on leave right now, but whose own background is in the sciences as well as in the arts. So Jill Ditter sort of got in touch with me, and then in the context of a department meeting in which Dean Seacott was there, and I talked a bit about that, she's sort of encouraged it as well. So this is, again, a very rough sketch of something that we had envisioned. And essentially, it was a kind of hub, right, with three distinct branches: narrative and creative competencies, which, as the sort of title suggests, include many of the people working in the creative arts therapies, in English, creative writing, professional writing, and so on. Bioethics and cultural competencies, which draws on a range of experts and disciplines to tackle issues related, as many people have been talking about, to care in the community, particularly Indigenous, racialized, LGBTQT communities, and so on, sex workers, and other people who have been traditionally sidelined in medical care, or who have faced challenges. And then the third is data and communicative competencies. Competencies was not a word we liked, but we went with it. which kind of engages with, and I think this has become increasingly obvious during COVID, the importance of case studies, scientific journals, scientific journalism, and data distribution, how it's done, what we expect from it, what the public understands of it. We've been living our life on various updates on data that I think most of us don't really understand and isn't really contextualized. So the idea for us was that we simply looked across the Concordia universe, and as we've seen today, saw all these amazing people doing all these amazing things. And it was just kind of what we wanted was to sort of provide a sort of organizational principle. So these three loosely sort of assigned hubs, which would house all these different researchers, but with those particular focuses. So from the sciences and the humanities working together. One of the things that my colleague and I were very upset about, really, when we looked at the proposal for the community health, was how little humanities featured. And my view, and I suspect everybody's view here, is that forward-looking health policies that don't take into account the humanities and the kind of research that's being done here isn't going to change very much. I think we're a critical partner in rethinking public health policy. So the idea is also, I know that PhD and higher levels of education have been mooted, but many courses, like for example, the one I mentioned earlier, the narrative medicine with my colleague in professional writing, these are courses that could be mounted really swiftly. Right? They could be and taken together or independently, but taken together could form a kind of micro specialization or certificate. The reason we're thinking more at the sort of undergrad level is that I know that there are many students in the sciences, for example, who migrate over to the English department for courses in English, but also creative writing. There's a lot of interest. So there's already a built-in community. And equally, I think there are a lot of students in our program who are benefiting from courses that Omri is teaching, for example, who perhaps want to explore science a little bit more. In other words, that partnership of the humanities and sciences in courses that are designed to get younger students interested before they go off into further careers, as I say, in medicine, social work, and various other sort of health-related fields. So that's really kind of our idea. And I'll just say two other quick things. I mean, it's been mentioned already, but we all know that, working with colleagues across the campus, sometimes even in our own department, is often really difficult. So part of this idea is to bring people together in a meaningful way to service the students in terms of the courses. But I would also put on the table that one of the aspects that I think is really key is an actual physical space in which people interact, because we've talked about silos, and that's very much how it feels. You're over there and we're over here. And even though we could just walk, we can't, we're all overwhelmed. An actual physical space in which people can interact both formally and informally, I think, is really critical. Now, when we put together this proposal and we sent it upstairs, I was told very kindly by the wonderful Derek Linetsky that this proposal looked great, but it wasn't the big ticket proposal that they were looking for, the thing that would get the billions from donors, right? I mean, and in fact, the whole point of this proposal was it's practical, it's doable. We could formulate courses next year, probably, if we really wanted to, which to me is an advantage to it. But of course, a space might be a big ticket donor issue. But I would really emphasize that I think it is critical. The 2020 Innovation Prize went to two chemists working in radically different fields, and well, radically different, they're both chemistry, but in different fields, in different faculties at Cambridge. And they extolled the virtue of meeting over a beer, and that it was the meetings over the beer that allowed them to sketch out this radical DNA sequencing that won them this prize. Now, I don't think beer is essential, although I would put it on the table that it would be, desirable. A little bar. sounds good to me. But I do think that idea that people can come together physically. And again, if anything over the last 2 years is taught me how much I emphasize being in a room together with people and in casual conversations, sparking ideas that really can ultimately, as these two scientists proved, change things drastically. So that's a long-winded way of saying that there's a sort of curriculum idea in process, and Mark has the proposal. I'm happy to talk about it more, but it is very much in the draft stage, but also a physical space where we can interact and that can provide support that everybody is talking about. Thank you so much.
Thank you, Kate. Kate, you're imagining a kind of a lounge space where maybe professors and graduate students whose work relates to the School of Public Health, they would be encouraged to get together. Maybe there would be events like a coffee hour or something like that, but also maybe it would just be a comfortable space in a central place where people might go work and might go meet each other. Is that the sort of thing that you're picturing?
I mean, ideally, there would be something even more lustrous than that. But I realize that may be pie in the sky. But I think more than just an informal lounge, places where classes could take place, and that it could be quite dedicated as a community health institute, where lots of creative things were going on. So yes, pie in the sky, but what the hell? If we can't dream, what's the point of life?
I don't want to put you on the spot, but do you have a picture of your pie in the sky place? Like what kind of physical space are you imagining? And then I have a couple of other hands.
Well, I would draw on the architects, but I would actually say that architecture, I think, is an overlooked element that we should be bringing to the table, because where people are sick, where people convalesce, where people can go to, exchange ideas, all of these things form part of a sort of my vision of a sort of public health policy, both the place where it's formulated and rethought. So I would leave it to an architect, but it would be something a little bit more shiny than the liberal arts college, but it wouldn't necessarily have to be much bigger than that.
Okay, now we might need the billionaire for getting the architects involved, but sure, I love it. Sounds great. Rebecca?
I'll just follow up quickly on what Kate was saying in two ways. The first is, just as an aside, the Faculty of Fine Arts engaged in some pretty serious space planning exercises where we involved students to a huge degree. And one of the exercises that we did was a futuristic design charrette. And we actually had futurists lead us in this amazing imagination exercise around space in particular. And there were some astonishing things that our community developed that I think could be very, very interesting in terms of Kate's pie in the sky. And she's so right in saying that it's something as simple as a space to have a coffee or a dinner together as it is a space that is open to the community, where we break down, much like Fourth Space, try to break down these walls between the university and the community. So we would be happy to share some of the findings that we discovered with our community. The second thing I'll quickly say is that, and I'll do this by way of an example. I think also space, if not designated for the School of Health, I think we need to rethink how the faculties themselves share their space with this right now nomadic School of Health. And an example of that is a course that we've been running with McGill in the Faculty of Fine Arts now for almost 4 years. It's called Convergence, Perceptions, and Neuroscience. And our fine arts students in dance, theater, music, studio, design, creative arts therapies, art education, art history, we work with PhD and postdoc students in the brain repair and integrative neuroimaging labs. And what distinguishes this relationship is that those students in the sciences and health come into our studios and rehearsal spaces, and we go into their laboratories. And it's been amazing to see how being physically in the community spaces of research and creation with these groups of students has completely changed the way they think about each other's practices. So this course is very much about really re-understanding one's culture based in one space. So I'll just say that I think that should be another thread that we follow through with, is being better at communicating and borrowing from the faculties the resources that they can share with us. And I think we've heard a lot today about spaces of production and spaces of training in, whether it's theatrical, whether it's movement-based, whether it's role play, things like this. I think that certainly the Faculty of Fine Arts should be called upon to invigorate the practices that many of you are talking about.
It's an interesting moment to do that, because we're going to have to reimagine our spaces to some degree. We're all going to be coming back to something that's been relatively inert. And I think the pattern is going to be to come back to it just the same way that we used it before, maybe with some small changes, like some more online classes, but that certainly doesn't necessarily have to be the case. There are some incredible resources in the university that are only really available to small groups of people, and there's a lot of actually bars to access, and some of those are deliberate and some of those are just bureaucratic and accidental, and perhaps, yeah, but I believe a building was part of the plan. Is that not the case, Mark?
Not that I've heard.
Okay.
Hopefully down the line, but so far it's not part of the plan. The plan is for a nomadic set of hubs, but I completely agree that our role should be to push for something different, even if it means occupying spaces in radical ways or in new ways, to sort of establish facts on the ground, so to speak, and say, show the need for the space by doing stuff first. And that's one way in which, next year and in the years to come, CISC can maybe be a helpful kind of launching pad for some things, the way the working groups now exist. We can book space, we can occupy space, we can make a series of events, on campus that then kind of register the demand and the need. It's not the lounge or the bar that Kate is imagining quite yet, but we can sort of kind of build it in a temporary form. We can model it, in advance, I think.
Thanks, Mark. Gilbert, you had your hand up before, but did you put what you had to say in the chat, or do you want to speak to it? And then Omri.
Well, I wanted to reinforce the idea of having a house or something for. We can develop the why it is there, but the interaction that we get in such contexts are tremendously important for developing collaborations and interdisciplinarity. And the Health Institute is essentially an interdisciplinary thing in the way we do it. We don't do medicine, we don't do much physical things that are, well, we have some parts of that, but it's by the interaction of people that we can see the interest into health. And so there is a need for students to mix together. There is a need for having place for having seminars that are interdisciplinary, that will welcome people around, that we could have a cafe causerie. So it should be a short conference with a lot of time to exchange and brainstorm ideas and things like that. And these meetings that we find sometimes in Congress, for example, they are the richest place for creation of new interactions. I saw it in many departments that were larger than usual departments. They add coffee place, just a place where you take your coffee and with blackboard on the side and something like that, so that they can use that space for hanging out, but hanging out not without ideas, hanging out to talk and to exchange, or to have a little question that just solve your life after that. Mm-hmm. So, and we need a place for having visitors, and and this is the time to to break the fences and the barriers. We don't want we don't want the Jody Butler to be the guest of one department and one group that is sticking on it and that is taking her, because if we think of the body, we all need a conference over. So where do we interact, and what are these things where we meet? And this is what we need to develop.
Yes, thank you. Yeah, I'm painfully aware of all of us in our different rooms feeling like we have had enough of Zoom. And one of the things I think I'm learning from this session, first of all, very many things, and thank you all for being so generous, but one of them is 2.5 hours on Zoom is too long. People are dry, or three hours, like people are dropping off. So, you know, you guys are hardcore. Good for you for still being here in your boxes. Definitely, I would rather be talking in a room with a couch and a bar and a coffee and yeah, all the other things that we're envisioning. Omri.
Yes, I too would enjoy that very much. But I did want to say that I would hate to have this conversation veer toward kind of celebration of spaces alone. It's something that Concordia knows how to do. It's the way it proceeds in general to build lab spaces for specific niche ideas. But in my view, and this is maybe to echo something Mark said earlier on in a somewhat different vein about wanting the conversation to be kind of substantive and idea oriented rather than around grant writing or kind of grant building, that I think we have to think much more carefully about the way we as an institution do cross-disciplinary exchange. And it starts with curriculum and the way we accord value to joint efforts to construct classes across faculty and across departments. And I would just note that in my experience, the models for this are often European. So things like, you know, a conference that I went to called Worlding the Brain in Amsterdam, or the Cognitive Futures Initiative. I just got an email from them today. They're going to have a conference in St. Petersburg. The last two have been online. But these initiatives that are European that kind of build on how to construct conversations that build research programs. And, you know, I'm not sure, I mean, the stuff that I see at McGill in the Division for Transcultural Psychiatry are often around like theorizing the ways culture and mind kind of shape illness experience. And of course, there are kind of models, the 4 E's. I had the privilege of being part of a book that came out from Cambridge called Culture, Mind, and Brain. I was just invited to do a small part of it. These are major neuroscientists. So, you know, I don't think we're all going to be interested in the 4 E's, for example, but I think we may have an interest in a common set of goals and topics around care, around how we envision the relationship between the humanities and health disciplines. And I would want more attention devoted to the ideas and more attention, initially anyway, devoted to how we can come together to kind of build talks, build classes, and so on. Although, you know, I just want to note how interested I was in the initiatives that Rebecca mentioned. I taught studies in literature and science, and at the same time, I was teaching this kind of undergrad class at the 300 level. Several of my students who were in fine arts were doing this program, and so I heard about it, and I'm interested. You know, those are fantastic examples, but I think, you know, spaces are wonderful, and we need those too. And I wouldn't poo-poo them for a second, but I do think some investment in how higher levels of the institution accord value and credits to faculty who are doing kind of cross-disciplinary work is hugely important, because we are a very siloed university and other universities aren't.
So one thing I was wondering wondering, Kate, when you were talking about these classes that would bridge humanities and sciences, would they be taught by different faculty together? And, there's always been this kind of credit issue with doing that because the university has various reasons that they do not want to pay 2 professors to teach a single course. And yet, if they don't, then it means that people are really volunteering some of their time in order to engage in something that is cross-disciplinary. Now, there are going to be a lot of questions, I think, about teaching in the School of Health anyway. Like, how do faculty members get borrowed from their home departments, and who gets credit, and how much can they be borrowed, and who gets paid, and do those classes get cross-listed, and how? And I do think that in some ways it would be really helpful to have some very concrete answers to those questions. And again, answers which make this a process that has less friction. So let's say you have a class on narrative medicine and you have a biologist who wants to teach it with you, or let's say, Omri, you have a class on in 19th century and 20th century ideas of emotion, and you have a neuroscientist who's willing to go in on it with you. You're not each doing it for 1.5 credits and developing a new curriculum and spending a whole lot of time. Like, if we are going to invest in cross-disciplinary work, it is going to probably require a little more than we've had available. Yeah, Kate.
Sorry, I was just, in fact, I'll take a lesson out of the Rebecca Duclos Wiley playbook, because we at one point were talking about this and we have utilized it, which is sort of synchronous schedules, right? So in other words, we did this with a course on translation and creative writing in the English department. So it was team taught, but essentially the courses were put on at the same time. And so students knew they were signing up for a course that was on poetry and translation. But one was the translation element was taken by Sherry Simon, and the poetry by my colleague, Mary de Micheli. So both got their 3 credits because both were fully teaching. Students in both courses got their allotted courses, but because the subject matter was aligned, they got a kind of fuller experience, right? So it was a class that engaged with both. There are creative ways of doing these things, and as you will know as well, my husband, when he was head of liberal arts college, organized a course which paired people from, teachers from the humanities and teachers from the sciences. So I taught a course or 1 class on, or 2 classes on beauty with somebody from the cognitive psychiatry. So, and that was sort of paired up. Now I can't remember exactly how the credits were allotted. I think we did all just give 1 class or something like that. But, depending on the enthusiasm and how you've structured it, there are ways of doing it. But yes, I would agree that part of, if the university is asking us to be interdisciplinary, and God knows they always are, then one of the things that could be demanded of them is a more flexible schedule or scheme for the allotment of credits that would facilitate this. But there are ways of doing it, and they have worked. So I would say that where there's a will, there's a way. There has always been a way. That's what I'd say.
Yeah, and if I can just jump in and underscore part of what you said in your first intervention, Kate, about the importance of training in this kind of work at the undergraduate level. I'm still thinking about the science students taking English classes and how we might, target those so that they're not maybe generic literature classes, but are more targeted towards future work in health areas or in science areas. That's very exciting to me, and as is the notion that it should be possible to put undergraduates in the same room as graduate students. And again, this is something, I mean, I in my previous life, I worked with Rebecca on curriculum back when the Convergence classes were just starting, and we were banging our heads against the wall, against the walls that prevent this kind of thing from happening. And as you said, that was solved through synchronous scheduling, but also, sort of going against the grain of the curricular structures that we're bound by, with putting undergrads and grads together, running project-driven courses, hands-on courses, and as Rebecca said, that involve, visiting spaces and sort of living in different research cultures. That's so important, and something we don't. Again, I think in fine arts, it comes naturally, but we still do it in a very siloed way. So we need ideas for how to kind of pilot these kinds of courses. And I know the ideas are out there, so we just need to make the requests, I think, as part of the report we're going to generate with these meetings. So thank you.
Kate, is your hand still up on purpose? No. Other questions about ideas for curriculum and the kind of education that might happen in this space, the kind of courses that might be taught that relate to narrative and representation. So far we've heard ideas about courses on maybe narrative medicine, maybe a class on death and dying. Kate and Jill, is that who you worked on the plan with?
Jill was the one who suggested that I wrote. No, it's another colleague in my department. Yes.
Oh, should we give them credit by name, or is there a reason we're not? Or no.
I haven't been able to talk to her, so I'll just.
Oh, okay. Anyway, this very useful division of narrative questions and bioethical and cultural concentrations, and then questions around data and communications. Those I think are all really interesting concentrations. So, Kate, you guys were talking about micro certificates or certificate programs. So right now you were envisioning this as maybe certificates that you could layer on each other so that you could just do the narrative competencies. I agree with you. I don't like competencies, but I like the three categories very much. So you could do something on narrative, you could do something on bioethics and culture, you could do something on data and communications, or you could do all three. And then maybe if you did all three, you would go into your, and you're talking about maybe students who are thinking about going into fields related to the health sciences afterwards, so that they could apply to those fields saying, okay, I have built up all these competencies and these are strengths that I'm entering into my graduate work with. Is that right?
Well, I think, yes, I think the idea is that you could take one course if you were interested in a course on narrative medicine, or you interested in a course on science journalism, you could certainly just do that. But for students who had a more focused idea of what they would be studying or wanted to continue on in that, it would offer a range of courses that could lead to a certificate. I know my colleague Maggie probably knows more about these. She's worked on curriculum. This is a new thing to me, but the idea that these courses wouldn't simply be tossed out, but that they would be orchestrated so that there was something concrete that the students could emerge with at the end of a period of study over the years. Yeah.
Okay. So that there are things that you could take independently, but there are also things that could work together, and they're designed to work together so that they have that function as well. And maybe cross-listed from the start so that people could get credit from their program, or who knows? I guess
that would certainly be something to consider for sure. Yes, absolutely.
Yeah. Rebecca?
Another silo that we don't often talk about at Concordia is the differentiation between the university and continuing studies. And I bring this up because I think if we're talking about a school of health, and particularly community health, the question is, where's the community? And I know a lot of us do work in the community, but it could be a very interesting model for us also to look at courses that are extremely relevant and current and responsive by formulating almost like what I want to say, an improvised special topics block where we could combine the work that's happening within our faculties with openings that are occurring within the continuing studies offerings. So we could actually work on and with members, real issues in the community with members from the community who themselves may want to get, some kind of, if not credit, they want to be within the university setting, but they're a non-traditional student. So this is another area that we have really never explored. And I think that this could be an opening for us to think about how to much more quickly and responsively work with the community members themselves, and to look at this as a community of shared learning rather than this sort of student-professor relationship all the time.
That's really interesting. So are you envisioning bringing somebody in from the community, let's say to co-teach a class, or are you envisioning more of a workshop model or a lecture model? How are you imagining this? Or maybe all three?
I mean, I think I'd want to talk to the folks in continuing ed right now to see what models they're working with. But I guess what I'm thinking is more of a topics-based or project-led workshop that would extend over a period of time, that would have a duration, and whose students were actually not led by an expert or a professor, but the community who comes in would be students in degree programs, but also community members in the health professions. And we would actually, co-design solutions to very real problems and very real challenges. And that's the course.
That's great. Yeah, Kate, you look like you have something to say to that. No, just leaning in because.
Sorry, I'm just leaning in. But I would argue that and I guess I would also say, just because I know that there are going to be strains of sort of the research model that's supportive of the research model, and then some of us who are maybe thinking more practically about how these things can be applied. And I would just want to say that I'd like to see both of those coexisting. I don't think they're mutually exclusive at all, but I think that's an excellent idea that Rebecca has. Yeah.
Maggie, do you want to speak, or should we leave that in the chat? Are you chiming in?
Yeah, I can't help myself. And the chat is my best friend. So yeah, I think that there are some fantastic ideas that Ariella, you've already given some great summaries of what we've heard so far, but I think that there's so much potential here in terms of experiential learning and communities of practice, both within the Concordia community and by extension to the outside community as well. So I'm hearing some fantastic ideas. And my own research background is not in healthcare, but is in narrative inquiry and autoethnography. And I think that there's a real space for that within the healthcare milieu. As I mentioned to you in a direct chat a couple of hours ago, there's some really great work that's been done. Carolyn Ellis, for instance, did some really great research with breast cancer survivors, where the narrative is about the personal journey through that illness and recovery. That is a really good complement to the more theoretical, practical, quantitative research that gets done.
Thank you so much, Maggie. It sounds like we're pretty organically moving to the third topic, which is just a question of community engagement. So that curriculum actually already can involve community engagement, not only in the more limited way that I had anticipated, which is maybe teaching some classes or opening some lectures to the public, but also maybe bringing experts outside of the academy into the university to engage them in a different kind of pedagogical experience, and also perhaps to engage them in a different form of the class in which the goal isn't just this sort of abstract intellectual inquiry, but a project-based learning or outcome-based learning. What other kinds of work with the community have you done, or can you imagine? Enrico was talking about, this work that he did with the YMCA, and I'm sure that many of you work with the community in one way or another. Anyone want to add anything else to that?
On my side, I have, yes, on my side, I have a course that is problem solving course where I don't get, well, technically they are doing a feasibility study for a problem that they define themselves in the communities of Montreal. We work with boroughs and we work with the table de quartier, and we look for sustainable issues, the sustainability issues that are not necessarily ecologic, that are community sustainability. And so they work on several dimensions, including health, including the situation of these people, often with people that are in vulnerable conditions. And they develop some solutions that are really tailor-made for an area in Montreal, like parkex for like south center of Montreal, centre sud, Montréal Nord, and other places where it can be hot at some point, but it's also like a lot of things. So last year we used the pretext of digital divide in the COVID. So it was to help people that were left on the side by the digital divide and the COVID to reintegrate people. This year is closer to the idea of feeling secure in your city. And so it's being part of it, but being part of your place that you live in. So it's a model, of course, that is challenging. It's always in kind of improvisation that I do it. I cannot plan it like three weeks in advance, but it's I coach my students in problem solving, and they discover the world about that. And it could be anything about health and community health and public health. Also, it could be a good course to give.
Do your syllabi for those classes give us useful information on how to do that? Or does so much happen in the classroom that the syllabus wouldn't necessarily be useful for us? Because I'm sure that we'd be happy to see that.
Well, you know, I teach it in human relations, and in human relations, we had a lot of trends over years of quality improvement, ground zero base budgets and things like that. And now the sustainability is one of the fashion thing to apply. I can share my syllabus, but it's essentially guiding a process of guiding the students.
Thank you. Valerie?
Yes. I want to return to the issue of curriculum for a minute. I don't know. I think I really see, and I find it would be important to have a course that, and I'm all for interdisciplinarity, but I think that given that it's a hub on, social life and culture, I think that I would really find it important for students who move through this program to have a course on the sociological dimensions of health and community. So, how normativity influences health and representations of health, how social positioning and affects also health and health practices and interactions. The history of health practices, how just the fact that we understand health in much broader, in a much broader sense than we ever have. So health has become very much, based in subjective well-being. There's a really interesting literature and sociology about that. You know, how social status affects health. And this is really my area. This is why I can speak to this. So there are so many ways in which we can think about this. And, you know, I'm not close to this idea of this being an interdisciplinary course, but I think that somehow we also need to transmit disciplinary outlooks that are essential in a hub that focuses on social life. So, and that, yeah, the pressures of everyday life in our world, all of those issues, I think, future health caregivers, you know, even the precarity faced by healthcare practitioners, like there's so many issues that could be considered in a sociology of health and the body. And of course, you know, the issue that I started out with, which is really the connection. And this is a really new, exciting, I think, new field. You know, we've thought a lot about the mind-body connection, but the mind-body society connection is really under-theorized and it's really under-researched. And so maybe a course that would have that as a focus, the mind-body society connection. So not just psychosomatics, but socio-psychosomatics. So I find we typically forget about the collective patterned and socially positioned ways in which health is affected. So, yeah.
That sounds great, Valerie. Ideally, I think maybe there would be space for these disciplinary courses that have a kind of a full picture from a particular perspective, and also for interdisciplinary opportunities for learning, and also maybe for some of these other pedagogic models, like the project-based model of the course or the model of the course that's led, not just from inside the academy, but with some kind of a collaboration, either with a community expert or a community question. Yeah. Enrico?
Thanks. this came to mind and I thought it was interesting. It was really stemming from one of the propositions that Gilbert made at the beginning of the conversation, that was like, you know, creating a forum in which, you know, academics can discuss and feed on each other's ideas and talk about collaborating and whatnot. But what about flipping that perspective and shifting it to the focus of the people who are consuming those services? And wouldn't it be interesting, just in the frame of this particular question that you're asking, how might the hub serve as a center for community-facing events and education, to flip that forum around in such a way that people had options to choose from this, like, various disciplines in the community-based context, you know? So just an idea I wanted to throw out there based on the question you asked.
What would be an example of that?
Okay, so for example, like I'm thinking my population, and I'm thinking that I run an adapted physical activity program that I have been running for many years out of the YMCA. You know, let's say, and you know, that the YMCA center where I ran that program opens back up because it's still closed because of the pandemic. But the people who are involved in that program have a forum in which they're not only exposed to what they can do in my research-based kind of context, but also other kinds of opportunities to be engaged in, let's say, you know, some of the work that everyone here has discussed, whether it's, you know, through narrative or practice of representation, through arts-based activities or other-based activities. I guess the pivotal thing that I'm trying to propose is that I think that as, you know, academics and researchers and professors or teachers, that we're all discussing, we focus a lot on how we can collaborate. But what I'm proposing is that wouldn't it be exciting and novel to have some sort of a forum in which people had more choices available to them in the ways in which they could be involved in these sorts of services or these kinds of programs, or ways in which they could be involved in something that would allow them to better lead their lives in the community-based context, with the overarching theme of it all being framed in community health. So participants from my program could have exposure or know more about a program that would allow them to be involved with art-based therapy or creative writing, and the ways in which that could offer them a lot of assistance as well. So that was just my idea.
Thanks, Enrico. I'm gonna pull up Brock's screen. Brock, if you can highlight your screen. He's been keeping notes, and I think I'm gonna maybe ask if anybody has anything else to add. Oh, this is really blurry for me, Brock. Is it blurry for everybody else, or can you read it?
Yeah, Brock, if you can zoom in.
Here, I can zoom in on the different sections.
Okay.
So I'll start with this one.
All right, so research topics.
Sorry, it like moves slowly.
Yeah. Huh. If you
keeping it there
pause,
now.
does the text sharpen?
I am not sure. I can zoom in like to get it to be sharper, but then you won't be able to see as much.
All right. So you know what? Let's drop the screen, actually. This is going to be very useful for the notes, but I'm actually not sure how much we can track it right now. Thank you.
A solution would be that you share the contact, and we all look on Miro directly.
Yeah, that would be great. My sense is that we've gone on a long time, and even though we have more time, everybody's brought a lot and probably is tired. So I just want to give you an opportunity to see if there's anything we've left out that you want to make sure to say before we go. Clearly, the people who showed up here have a lot to bring to this kind of program, and I very much hope that you're involved in different ways as it becomes more and more reality. There's a lot of skill and experience and ideas around the table. I really appreciate all of your collaboration and your ideas and your excitement. Anyone want to add anything or any last thoughts?
Yeah, I mean, I'll just jump in and say again, thank everybody so much, and not to conclude it if there's more to say, but yes, we're losing people. It's Friday afternoon. There's still some sunlight outside, so I think we can wrap up. I just want to say a couple things. We're gonna, do our best to synthesize all these amazing ideas and sort of beginnings of discussions. We'll be in touch with some of you to follow up on what you've contributed. I think there's already so much. We're definitely going to think more about curriculum, about space, about ways of conceiving of a hub that's both deeply practical and ambitious, so I think it's amazing what you've all contributed today. I have a little plug for an event that relates to what we're discussing. I'll put the link in the chat, and you'll probably receive something on email as well. But this is a performance event that CISC is sponsoring. It's a roundtable of 3 artists working in the format of picture recitation, so narrative, both visual and spoken and sung narrative, and medical and scientific knowledge. And this is once again hosted by our dear Fourth Space, and hopefully some component of it will be live. We're not sure about that yet, but February 18th, the link is in the chat, so I hope some of you will be able to join. I also hope that you'll join the others of these meetings. So our next one is on Wednesday, February 16th, and there are 2 in April. So we kind of skip March because March is so crazy in so many ways with the concluding of classes. But once classes are over, we have a meeting on the 14th of April and the 28th. And I hope that for some people who aren't with us right now, but their schedules may clear once classes are over. So it's going to be a different conversation every time we meet. And I hope we'll have some of you returning. So thank you. And thank you to the rock star Ariella for moderating.
Thanks also to Anna and to Brock for taking notes, and to our ASL interpreters.
Jody and Andrea.
Can you do Rockstar again, Andrea? What does that look like? That was cool. All right. Anyway, thanks so much for your generosity in showing up on a Friday afternoon. I really appreciate it.
Yeah.
Bye.
Awesome. Thanks, everybody. We're going to close up the Zoom now. See you next time.
Thanks, everyone.
Take good care.